Hello, my name is Dr. Huey McDaniel. I'm a vascular surgeon, and I wanted to talk to you about abdominal aortic aneurysms, or aneurysms in general. An aneurysm is a dilated artery, and that can happen anywhere in the body, the extremities, inside the head, in the chest, or in the abdomen. It's very common to see aneurysms in the abdomen, abdominal aortic aneurysms, or AAAs. And these are, not everyone needs to be fixed, but if it's large enough, you want to have it fixed. I've had the benefit of watching this disease process over the past 2 decades that I've been in practice as a vascular surgeon, and it has changed drastically from the way it used to be offered. An aortic aneurysm is a dilation of a blood vessel. Abdominal aortic aneurysms are more commonly seen in people that have had a history of smoking, have high blood pressure, or have high cholesterol. Abdominal aortic aneurysms are 5 times more common in men than women. It's actually the 10th leading cause of death in men over age 55. Without monitoring and treatment, the natural history of abdominal aortic aneurysms is for them to continue to grow and eventually rupture. Several famous people have had aneurysms that have ruptured. Albert Einstein, Charles de Gaulle, World War II hero and former president of France, and others. When these aneurysms get larger, they're more likely to rupture, just kind of like blowing up a balloon. The larger it is, the greater chance that it will burst. Should I get screened for an abdominal aortic aneurysm? Well, Medicare screening is done for anybody that's new to Medicare insurance. And they also suggest screening for anybody who's over 65. If you have more than a 100 cigarette lifetime use, you're at risk for aneurysms. Men and women with a family history of abdominal aortic aneurysms. And screening is important because it decreases mortality from aneurysms approximately 44%. If you have any of the previously listed risk factors, or your primary care doctor is concerned for possible aneurysm, they may order an abdominal ultrasound, which is a non-invasive way of evaluating the aorta to see if it is aneurysmal. Should I get my aneurysm repaired? Just because you have an abdominal aortic aneurysm doesn't mean that it needs to be repaired. We base it on size. We also base it on the speed at which it grows. So anybody with an aneurysm that is under 4 centimeters, it's not likely to rupture, but it definitely needs to be followed. In fact, we try to follow aneurysms that are 3 to 4 centimeters in size. They may never get large enough, they need to be fixed. And just because you have it doesn't mean you need to have it fixed. But once it gets to be greater than 5.5 centimeters in men and 5 centimeters in females, the risk of rupture is much greater per year than the risk of doing surgery. If the aneurysm happens to be in the chest, what we call a thoracic aneurysm, then we usually treat those when they're about 6 centimeters in size. But anybody with an aneurysm, we are happy to follow, and we generally do that every 6 months with non-invasive studies such as ultrasound. How can I get my AAA repaired? Well, everybody's anatomy is a little bit different, and depending on the anatomy of your aneurysm, you most likely are a candidate for an endovascular repair, or a less invasive way of repairing an aneurysm. However, some people may not be a candidate for that. They may have to have the old-fashioned way of open repair. We do both open and minimally invasive repair. The minimally invasive is great because folks usually are home the day after surgery, and post-operative recovery is a couple of really, really small groin incisions that are about the width of your pinky finger. An abdominal aortic aneurysm that has to be repaired in an open fashion, there's a lot more involved, and it's about a week's stay in the hospital. If you are a young patient with an aneurysm, or your unique abdominal aneurysm is best repaired by open techniques, a vascular surgeon would suggest that. However, that sort of operation requires a longer hospital stay and is a longer recovery. In this day and age, we try to do less invasive or endovascular means by which to fix an aneurysm because the durability of the repair is good, and the recovery and speed at which patients can get back to their normal activity is much quicker. What does a vascular surgeon offer in the treatment of abdominal aortic aneurysms? Vascular surgeons specialize in both minimally invasive as well as open surgical treatments for aneurysms. Vascular surgeons assist their primary care physician in helping monitor aneurysms, and when it is appropriate to fix, at that point we suggest fixing it. We also are involved in post-op surveillance of an aneurysm after a repair in the event that some additional thing needs to be done. And based on the unique anatomy of your aneurysm, your vascular surgeon will suggest either minimally invasive or an open surgical approach to repair your aneurysm. If you wish to find out more information, please visit our website or call the office. We'd be very happy to talk to you.